Welcome to the ASTO webinar on Caregivers Learning Community and Opportunities for Public Health Collaboration. We'll be starting in just a few minutes. Good afternoon. This is Sharon Moffett at the Association of State and Territorial Health Officials. We welcome you to our call today. We see that we have a number of people that have been able to join us, and I'm very pleased that we have an excellent panel of presenters to hear from today and learn more. Our focus today is obviously on the caregivers and how, from a public health perspective, can we collaborate to support caregivers in the multiple challenges that they face. This is a significant opportunity for us. I think you're going to hear about some very exciting work that has gone on from our presenters today. To take the first few minutes to just orient you a little bit to ASTO and some of the current work that's been underway and the problems that we are facing. So we do ask a couple of housekeeping things. We're going to ask you to be on mute. If you have a question, please type into the chat box, or at any time you can also press *7 to unmute your line. We'll do that during the question and answer session. We'll leave time for that at the end. Following the webinar, we'll also send you a link so you can access the PowerPoint presentation and also this webinar recording. So again, it's *7 if you have questions, and we do ask you to go on mute. Thank you. So today we're actually going to hear from, as I've mentioned, an esteemed group of panelists to really help us understand more of what they're doing in their work. I'm very pleased that we have Kirsten Arid, Chronic Disease Program Manager for Health Promotion and Chronic Disease Prevention out of Oregon Public Health Division. I think you'll find some very exciting work that they have underway. And then Tracy and Rachel will be speaking to us from New Mexico, and with from their Office of Alzheimer's and Dementia Initiative, and also the Long-Term Services Department, and also the work in connection with the Health Promotion Health Department of New Mexico. So again, a lot ahead of us and a great learning opportunity. This is just a brief bio of my background. I'm going to skip through that, but essentially what I think is important for you to know today that ASTO has been working for quite some time in the area of healthy aging, working closely in partnership with the Alzheimer's Association and the Center for Disease Control. So this has been a significant opportunity where we have had a particular focus on caregivers, the challenges that they face as they're working with the aging family members and aging community. And this is just a little bit about ASTO, and again, you can see how well our work with caregivers lines up with our vision and mission, but much more work ahead of us, obviously, as we work to transform public health within our states and territories. Just to give you a moment of a snapshot of ASTO's membership, it includes the state health officials and territorial health officials. So we actually, our membership covers over 10 time zones and goes beyond just the continental United States. We've been very fortunate in doing our learning collaboratives, and you're going to hear more about that. We identify emerging best practices, emerging innovations from other states, and then we create these learning communities so that we can learn quickly and rapidly look at how do we spread and also sustain the efforts that you're going to hear about today. So I'd ask for you to think about as you're framing your questions for the end of the call is to really consider how might you adapt or adopt these initiatives in your own state. What are the opportunities and challenges for sustaining and spreading these? So at this point, I'm very pleased to be able to turn to Lynn Shaw. Lynn has been our senior analyst in the area of healthy aging and Alzheimer's work, and particularly been leading our work with caregivers. So Lynn, I'll turn it over to you at this point.
Great, thank you. And so I'm just going to provide a little bit of background on sort of why ASTO really felt this was an important issue for us to address. And I know that many folks on the call are already aware of these statistics, but certainly just want to highlight that 87% of adults 65 and over want to stay in their current home and community as they age or age in place, giving further need for caregivers. And then also about 34.2 million Americans have provided unpaid care to an adult age 50 or over in the past 12 months. And I think that's even an underestimate probably of how many of those are providing care for family members. So certainly an important issue for us to address in public health and across the Healthy Aging Network. And a few more statistics that really highlight more specifically that about 15.7 million adult family caregivers care for someone who has Alzheimer's disease or other dementia. And then also the value of services provided by informal caregivers has steadily increased over the last decade, with an estimated economic value of $470 billion in 2013, and certainly expect that number to continue to grow over the next 10 years as well. And so ASTO really, in partnership with CDC and other partners across the country, really recognize the importance of public health contributing to this important issue and learning from our Healthy Aging Network partners and state and local partners in that field. And so some of the opportunities that we identified through our work together for public health contribution are convening a cross-section of stakeholders, elevating caregiving as an issue to state and national leadership, being champions for evidence-based intervention, providing data to establish metrics to identify areas of need and assess progress, and integrating caregiving into existing and or emerging public health plans. So I know within states there are a lot of different plans. There seems to be one for each issue. So just really integrating healthy aging and older adults and caregivers into those plans is a great way to streamline them and ensure that it's an important issue across a number of other issues as well. And so ASTO, with funding from CDC, was able to form a caregivers learning community and provided technical assistance to 4 states, Mississippi, New Mexico, Ohio, and Oregon. And the goal of the learning community is to really exchange ideas. So states learn from another, they learn from other national experts, and really ASTO learns from them. So even ASTO, quote unquote, provides technical assistance, and we do, a lot of it is really us learning from the states who are willing to participate in the learning community and share that with our membership. And so sort of like I said, they just sort of act as models, and what they learn we really highlight to our members and others in the field. And so through the work with the states, New Mexico and Oregon will highlight some of the key partners and key learnings from their work, but wanted to highlight some of these important partnerships from across all of the states that we had worked with, so academia, Home Care Commission, Department of Medicaid, local health districts, and many, many more at the local, state, and federal level. And some of the key successes that we were able to witness in our demonstration states were increased cross-sector partnerships and facilitated discussions to promote and implement programs supporting caregivers, increased data collection through BRFIS, improved referral systems for connecting caregivers to services such as respite care, adult daycare, and educational programs, passing of legislation such as the CARE Act in New Mexico to support family caregivers when their loved ones go into hospitals and they transition home. And then expansion of TA and training to teams working at the community level. So our presenters from Oregon and New Mexico will touch on all of these things in their presentations. So I'm excited to next hand it over to Kirsten Aird with the Oregon Public Health Division. She's been working 15 years in public health, fostering those public-private partnerships and cross-sector relationships that we've talked about. And she graduated from Emory University School of Public Health with a master's degree in public health policy and management. And with that, I will hand it over to you. Kristen, you might be on mute if you're talking. We can't hear you.
Hello, can you hear me now?
Yes, yes we can.
Okay, I was on double mute. I had hit *7 and was still on mute on my cell phone.
Oh no, sorry.
I apologize.
No
Thank
worries.
you all for the opportunity to be with you this afternoon and to share a little bit of Oregon's experience and more to share some of the questions we still have and the opportunity for all of us as public health professionals to think about our role in supporting the population as it ages. And that really has been the perspective that Oregon has taken with our approach to the work. And I'm trying to see where I can advance the slides. Yep, one too many. Oh my goodness. There we go. Okay, so we focused very early on with the stakeholders, but the perspective with stakeholders was more that we already knew some great work was happening throughout the state, and we didn't want to come in as if public health was here to save the day and do take something over that already has really good momentum behind it, but it was more figuring out what is our value added to the conversation and how do we reinforce the great things that are happening and use one of our strengths, which is data, to drive some of the direction and strategic planning moving forward. So we brought stakeholders together, but more as a neutral convener, an entity, really focused on population data and started looking at new data through BRFIS and also implemented what we refer to as a panel survey, which is a really great rapid way to get good representative data of populations with a quick 2-week turnaround time. And then how do we start placing public health professionals both in the state and throughout our counties and tribes to be champions for this work and really clearly integrate healthy aging and caregiver health into our emerging public health plans. So this is something I'm sure that is familiar to all of you on the call. One of the things that we did to help prepare the workforce for thinking about looking at health past the age of 65 and across the lifespan was to come up with some examples of what it looked like to use Frieden's pyramid. And so if we were to apply some of our healthy aging, caregiver health, cognitive health perspectives in this kind of framework, we'd know that at the bottom, something that would be really important is the ability for adults to live independently as long as possible and transition when necessary to safe, affordable living situations and housing, that retirement is ample and they're able to have the resources to take care of themselves. Without those things, we know health outcomes are a lot worse. so who are the multi-sector stakeholders that can help influence some of those socioeconomic factors that this builds on. And then thinking about changing the context and the role that public health partners can play, whether you're in chronic disease prevention or in maternal and child health, is thinking about what does it look like to implement nutrition standards where adults may spend time if they are in a respite care setting, so their adult caregiver can go and have a break. How do we know that the standards in place in those settings meet nutritional guidelines, or that the food that might be dropped off on Meals and Wheels is meeting nutritional standards? And so we've done a lot of collaborating with our State Unit on Aging around those kind of social context things, and then moving into long-lasting protective interventions, really thinking about our partners in pharmacy and our immunization programs and Medicaid and Medicare, and transitioning kind of with dual eligibles, and thinking about how do we set up systems for flu and pneumonia vaccinations, shingle vaccinations, kind of those long-lasting protective interventions that we know are important, and also how do we make sure that not only is the older adult is having access to these, but their caregivers have access to these as well. So what does that look like to look at two people as individuals and yet an important unit to have access to these resources? And then continuing to move up to clinical interventions and making sure that that interface is important, particularly around dementia screenings, and how do we assure that primary care providers have that knowledge and resource base to do that work? And then what does it look like to engage caregivers in that conversation as well? And then all the way up at the top, counseling and education services. We've made a significant investment in really trying to think about those community clinical linkages to evidence-based self-management programs and practices that could be available for caregivers as well, so they can look to take charge of their health and managing their stress as they're taking care of a loved one. So we set out early on to set up that kind of perspective, so we knew what areas we were going to kind of play in, if you will, what strengths we were going to bring. So most recently, we have done a lot of cross-section work with public health and aging partners. And in fact, I'm doing this presentation from a different office. I'm out of our Salem office because we're having a cross-agency health improvement project meeting, steering committee meeting, which is leadership from both the Oregon Health Authority and the Department of Human Services, which houses our State Unit on Aging. Leaders from the different divisions across those two agencies coming together to think about employee and consumer health, which caregivers health fits right in that, both very clearly. So that kind of agreements across sectors and partners within state agencies that we're trying to do. We've developed training plans for public health professionals. I talked to you a little bit about using Freedom's Pyramid as a way to help ground people in this. And then we just, and this was the biggest undertaking, completed a list of what we consider our healthy aging indicators for the state of Oregon. So an agreed upon list that meets, we worked on it with ARP and the Alzheimer's Association and our academic universities to really think about what are those key indicators we want to look at in Oregon that would look at health across adults as we age, and also for the caregiver's health, and what does it look like to identify opportunities to make improvement and then track that improvement over time. This slide really just emphasizes what Lynn had said early on, the importance of partnerships. We've tried to be really, really clear that we acknowledge and honor that this work has been going on for a really long time. And public health is a little a new partner to working with all of these others. And so what does it look like to come in and add value to and not distract and take away? And so just being able to be that convening entity and providing data has proved to be really fruitful for us here, and really lines up so nicely with public health modernization, which is a priority here in this state, and really thinking about what does it look like to do population health in rural and urban areas across a very large, physically large state. I mentioned the collection of data, so we implemented the BRFIS caregiver module, which has told us a lot. We, thanks to our partners at the Alzheimer's Association and ARP, the state was able to get some consistent funding to implement BRFIS, specifically the caregiver modules and the cognitive impairment modules, and those continue to be something that the legislature has allocated to public health to implement using some of the older adults, the state allocation of older adult funds. And that has been really helpful in kind of identifying where we have opportunities for improvement. And you can see some of our data here. We have been collecting that through 14 and 15 as well, and are looking at that analysis that shows up in our Healthy Aging Index, which I tried to pass along, but it has so much data in it. I'm going to have to figure out how to reconfigure it to share it with other states, but we are happy to do that. So really focusing in on our public health goals after certainly looking at data is how do we elevate the caregiver health into civic discussions? What does that look like to really have that be part of healthy communities and healthy aging conversations that are happening? Our ARP did a year-long strategic planning effort with a number of partners that really look to understanding respite care and caregiver health, and in kind of teasing apart respite care, really coming to understand the lack of knowledge, awareness, and understanding of what respite care means, which makes those questions we ask in BRFIS kind of difficult to use, because what we've come to learn in conversations and focus groups is that that is not a well understood word, and if we know it's important, then we have to find different ways to talk about it. So really thinking about the language we use and how we elevate that into our conversations to meet multiple generations' needs. The other thing that we really try to focus on around caregivers is that this isn't just for one population or another, but caregiver health and caregiver support crosses the lifespan and really is something where young family advocates, working family advocates, and adult advocates, we can come together and really think of some good family medical needs and supports and services that can exist. So it really is expanding the partnership and the network to make change happen for the benefit of all. And then another approach that we're really looking very strongly at is worksite wellness, and how do we advance, as the population ages and people are working longer and therefore may need more caregiver support needs within the workforce, how does that become part of our vernacular and our conversation in thinking about what it means to have a supportive worksite, both from an environmental perspective, but from a benefits perspective, and then from that employee empowerment perspective, so that you kind of get that complete picture of my environment makes it easy to do X, the benefits support me in doing Y, and I'm motivated and have the ability to take action. And there's a caregiver lens around that that's really starting to happen here in Oregon, both from a public employee perspective, but also from a private employer perspective as well. So that's exciting to be part of, and exciting to not actually lead, but to watch others do that and then just contribute where we can with data and information. And then, again, continuing to refine and think about the role of public health in this work as we move forward, and really being clear and honor that around our strengths and not getting in other people's way. So public awareness campaigns, particularly around caregiver awareness on respite care and supports, and again, really thinking about reusing or using a different word. Staying true on data collection and continuing with the collection of BRFIS data, and also exploring opportunities to use panel surveys, which again provide more rapid feedback quickly, and how to leverage other resources for those opportunities, focusing on worksite wellness, and then providing data and support and resources for our partners. And then in continuing to think about, ASTO has been a wonderful partner in bringing us together with other states, because that's how a lot of these ideas were generated. We did not come up with these all on our own. It has been the opportunity to work with New Mexico, to work with Connecticut and Mississippi and different states that were involved in the healthy aging and cognitive health work earlier as well. What did we learn in those efforts, and then how do we continue to build off of that and really get momentum and continue to refine where public health can fit? So I think continuing to ask ASTO for that kind of support is critical, and then thinking about some of those broader issues that can happen at a national and federal level, and where we're more powerful when we do things together than when we do things independently. And then I'll add with, recommendations or suggestions to other states. We can't do this alone. Public health is part of this, part of the conversation, but the conversation very likely, as you all know, has been happening for a long, long time, and maybe we were part of it and maybe we weren't, but that if we, intend to intentionally become part of these conversations, how do we honor all the work that has come before, and then really bring that key value of data, communication strategies, and policy system and environmental change strategies to improve health outcomes for all adults as we age, and those who are caregivers for older adults, and thinking about what their health needs are as well. Certainly recognizing some significant health disparities that happen among those who care for their loved ones. So I will leave it at that and wait for questions at the end.
Great. Thank you so much. If anyone has a burning question right now, please feel free to type it into the chat box, and we'll be sure to address it at the end of the webinar during the question and answer and discussion period. So thank you so much. And we will now move on to New Mexico. So we have Tracy Wool, and in the interest of time, we'll give sort of the abridged version of her biography. So she's worked at the New Mexico Aging and Long-Term Services Department since 2006, working with the Aging Network home and community-based services, including services for caregivers. And since 2014, she served as the director of the ALTSD, Office of Alzheimer's and Dementia Care, and is charged with the implementation of the New Mexico State Plan for Alzheimer's disease and related dementias, and components of the New Mexico State Plan for Family Caregivers. And she is joined by her colleague, Rachel Wexler. And Rachel has worked with the New Mexico Department of Health Public Health Division since 2014, and she supports counties and health councils in prioritizing and addressing their most pressing health issues, including issues such as adult fall prevention, diabetes, obesity, and access to care. So with that, I will turn it over to Tracy and Rachel.
Okay. Thank you, Lynn. I just wanted to, briefly reiterate what's already been said about the learning community. New Mexico was also involved in the healthy aging learning community, and so this was just a natural extension to continue with the caregiving community. And the learning community provides us with support and educational opportunities and a way to learn from other states and from ASHTO and get support about moving forward with our caregiving initiatives, and it helps to keep us connected and focused on those issues. And one of the things that happened because of this is that I have a monthly meeting with Barb Howe and Rachel around how we can work on healthy aging and caregiving issues. So it's been a great assistance to us in New Mexico. And then just briefly, New Mexico is, the statistics have been provided previously. New Mexico is a large state, a large geographic state. I believe we're probably the fourth largest in area, and we have we have a small population of 2.1 million people, so we have a lot of rural and frontier areas. But we do have, as everywhere in the country, we have lots of caregivers, 277,000 at any one time, and around 419,000 annually. And we have about 106,000 dementia caregivers in the state. And so that's a lot of my focus, of course, is on dementia caregiving, but we work on all caregiver issues. So in New Mexico, we have a lot of New Mexico-specific data, and I just wanted to list some of the reports that we have here in the state. And some of that has been from our AARP New Mexico chapter. They've done a lot of surveys here in New Mexico to support the caregiver plan. And so you can just see that we do have state-specific data. And of course, since I work in the state unit on aging, just wanted to call attention to the participants on the call that the state units do have data from the services and supports that they provide, and so do the area agencies on aging. So it's a very a good source of data for those states that aren't connected with their state unit or their area agencies on aging. And again, like I said, we do have a state plan on family caregiving, and we also have a state plan on Alzheimer's disease and related dementia. The state plan on dementia is undergoing an update right now, since it already is 4 years old. Time really goes quickly. And our caregiving plan is just 2 years old, but we probably soon will need to take a look at that as well to update that. But those are the documents that really help guide what the kinds of activities and initiatives that we try to work on are really guided by those two plans, and then the data that we have available to us. Our Department of Health also has done the BRFIS cognitive decline module and the caregiving module. We just have data from the 2013 cognitive decline module, but we're looking forward to getting the rest of that in the near future. So some of the strategies and activities that we have been doing here in New Mexico, one of the Department of Health, the Public Health Department, Barb Howe, who's not on the call today, she was able to write a small grant that was provided through the National Alzheimer's Association and ASPO to work on the Brain Health Initiative and the Public Health Roadmap for Dementia. And so through that grant, we've been working on the evidence-based health promotion services, connecting our state already has been implementing a Savvy Caregiver program for dementia caregivers, which is an evidence-based caregiver education program. So we really were trying to connect those Savvy Caregiver participants with the evidence-based health promotion programs for chronic disease self-management and diabetes self-management. And so that's going on right now. And one of the things that we are doing with that is, as you know, dementia caregivers are, it's 24/7 with most dementia caregivers. And so we thought that if they could be also connected with a health promotion program, then we wanted to offer them respite services so that they would be better able to attend those. So we're working with our Alzheimer's Association and our state to promote a respite voucher program so that the participants from Savvy Caregiver can just make a smooth transition into the chronic disease self-management programs, and then also have respite vouchers available to them so they can have some way to attend without having to be concerned about who's looking after their loved one with dementia. So that's going on right now, and we're hoping that we'll have some good evaluation data from that as well. We're working on strengthening our information referral and education for caregivers. Our Aging and Disability Resource Center is centralized in New Mexico. It's here at our agency, so we're able to easily communicate information about services through the Department of Health for Healthy Aging service programs through our Aging and Disability Resource Center. And so when caregivers call here, they have easy access to that information, and we also have an online database that we make sure that we get all that information input into that as well for the caregivers. And one of the things that also is going on in New Mexico is, as probably in every state, we have a lot of grandparents or other kinship caregivers that are raising their grandchildren or their other minor relatives. And so for the past 3 years, we've had a task force looking at those issues and how to, what kinds of needs for caregivers need to be addressed in New Mexico, and then how we need to tweak the different systems that the kinship caregivers have to use to provide their services for their grandkids or their other young relatives. So we do have a report coming out on that as well. And through we do have some legal services available to our kinship caregivers, and we're starting to develop different kinds of support groups and information and referral sources, and working with our Children, Youth, and Families Department and our Medicaid Department and our educational systems to tweak those kinds of the services that are available to them to make them more easily accessible to meet the caregiver's needs. And that's probably, that's probably something that's going on in many states as well. We also are working to make sure that we get a lot of information out about advanced care planning and legal services. We do have the Late Caregiver Aftercare Training Act in New Mexico now, which is when there's a person in the hospital that is going to be transitioned home, if they wish, they can name a caregiver, and the hospital is to provide training and information and support to that caregiver. So when the person goes home, they do have some knowledge and information about what kinds of medical or support needs that the person needs to have. And then we've worked with brain health we've used the brain health toolkits and have worked with the Department of Health to get that information out all over the state. And our AARP does a lot of careversations, and so we also try to publicize those and tie in with those kinds of activities as well. Oops. Lynn, can you advance my slides? I've lost my okay, there we go. I found it. I got it. Sorry. I wasn't paying attention to the slides. So just quickly, I'm on what the Department of Health and our Aging and Long-Term Services Department, kinds of coordination things we do. We look at what kinds of public presentations and conferences and workshops are coming up, so we work together to develop workshop proposals, and then carry out those workshops at these opportunities. We're working to include caregiver data information into state planning documents. Again, the state units on aging have a state plan, and the area agencies on aging also have 4-year area plans. So those are good places to work to get the caregiver information and healthy aging information in those plans. we have a state caregiving dementia leadership team that works on advocating and supporting and the state dementia plan and the state caregiving plan. So that leadership team meets quarterly, and it has membership from the big agencies in New Mexico, Department of Health, our Human Services Department, the AAAs, other stakeholders that are interested in caregiving and dementia issues. We meet quarterly. We too are taking a look at respite, like in Oregon. We do have some, there are respite services, but again, we have found that the caregivers do not understand that terminology, and there's also studies out around that respite needs to be used early in the caregiving experience, and it needs to be used for actual activities that the caregiver enjoys, not just giving them a break to run errands or do all the things that you need to do. But it's really, so there's lots of little nuances to actually how respite services should be provided. So our group's looking at that right now and hoping to make some recommendations around that. My office meets with Rachel and the other health promotion teams in New Mexico, and we've been doing some education about caregiving and what the referral sources are and what's going on in their regions around caregiving, and so they can help the people in their regions. And then we've been working with the Community Health Workers Office in New Mexico to try to bring some training around dementia caregiving to those community health workers, so that when they're in their home communities and they find that they have need to provide support and education and resources to their dementia caregivers, they'll know how to make those referrals. And then we work on data collection and analysis, and then again with the ADRC resource and benefit information. And then some of the things that Rachel and Barb and I meet about and are looking for ways to target more activities are into some of the injury surveillance and prevention services at the Department of Health, and so those are some of the things we're going to look at in the future to see how we can get some targeted activities for caregivers, targeted messaging for caregivers around those activities. And so lessons learned, it's good to have the support of our high-level state agency officials, which we do. And again, what was talked about is demonstrating the dimensions of caregiving as a public health issue. That's very important. Developing a culturally competent caregiving plan. I think our leadership team is critical to all this, and I think that's been a really good, a really positive outcome of our work, and also to engage those members of those leadership teams in activities that promote the implementation of the plan. The team members are very dedicated and committed, and they really work. They identify opportunities and ways that we can promote that all the time, and they're very, very dedicated to our efforts, and document the outcomes and update the plans, publicize and recognize successes, and develop working partnerships. That's really key, is to develop all those working partnerships, and then implement training for key staff. And even though caregiving is very it's being more recognized as a public health issue, there's still need to train staff about what that means and what caregiving is and how caregivers' health is affected by the caregiving journey. And so it's really good to keep to keep focusing on training for staff. And then discover and utilize the strengths of involved agencies to avoid duplicating efforts. So that's basically what's going on in New Mexico.
Well, thank you, New Mexico and Oregon. What in-depth presentations. Those are extremely helpful, and appreciate your slides. I think those will be extremely valuable to both the participants on the call today, but also others who weren't able to participate. Just checking the chat box, I don't see that we've had any questions come forward here. So what I'd like to do is make sure that people know to press *7 to unmute their line. This is Sharon Moffitt speaking right now, and also suggest, Lynn, if you have any questions that you want to bring forward. But one of the questions that I might ask you both to address is how, with the other multiple pressures within a public health agency, have you been able to identify the resources being not only funding, but also the person power? So, Kirsten, could you speak to that first, perhaps?
Sorry, unmuted. Yes, can you say that question again?
Wanted to ask you how, with all the other demands in public health and public health agencies, are you able to find the funding and resources, people power to lead in the way that you have?
Yeah, that's a great question. And the centerpiece of this is that we didn't look at it as something new and different. We looked at it as that this is what we do. And it fits really nicely in chronic disease in the perspective of, the infrastructure we've worked to build around chronic disease self-management programs, that community clinical linkage, building those relationships with health systems, but also thinking about those community supports. We know that caregivers smoke and use tobacco at a much higher rate than the general population. So, and that's just one example. We just really tried to look at it from the perspective of this isn't new or different. This is our job, and this is a population that we need to address in the state of Oregon. And I think that approach has really helped us have conversations with our colleagues in local and state public health departments, so that we really present this as an opportunity to do our job as best we can versus doing one more project or program.
Great, excellent example. And again, I think what you presented with your population data kind of reemphasizes and demonstrates how you've used the data to then bring to light the needs. Tracy, if I could turn to you in New Mexico and just ask you to consider how do you continue to keep caregivers in the work of dementia in the forefront?
Mm-hmm. Okay, well, again, several things. We had a perfect storm of the legislature passed memorials around dementia planning and caregiving planning, so we did have some legislative support. We have our former secretary of our department took the position at the Department of Health as the secretary, so she was quite aware of what was going on in our department and what was going on with caregivers. So I think that had a lot to do with how this has come about, with being able to keep this in focus. And again, caregiving is an issue that almost everybody ends up dealing with at some point in their life, and I think people are starting to recognize that more and more, and they also are starting to recognize that it is a public health issue because of the demands of caregiving. And so I think that it just is a natural fit about a lot of the initiatives at the Department of Health with injury prevention and chronic disease and what's already happening. Caregiving programs have been going on through the Older Americans Act since 2002, I believe, and so there's been some work done already around that in the state. So it just all kind of fell together. And then of course we were able to participate with the Healthy Aging learning community, and I think that just kind of helped us to really keep it, put it together and keep it focused.
Great. A lot of excellent examples, and again, we will long hold Retta Ward in our memory and her amazing leadership, and this is just another way she's touched us all. Lynn, if I could turn to you and see if there's anything that you would particularly like to do, bring forward for questions, and then we have a question from Molly French. But Lynn, maybe I'll first go to you and see if there's any area that you would like us to emphasize.
Mm-hmm. No, I think the presentations and discussion have been extremely helpful in further highlighting the opportunities among public health and healthy aging. So, I'll just read Molly French's question aloud, which is, what are some long-term, for example, 5-year goals to support caregivers that you are working towards?
This is Kirsten. I'm happy to take a stab at starting that. I think, if I were to think of what a 5-year goal may be and what we're trying to do, it's really in using some of the community information that was gathered by ARP around caregiver health. And I think part of it is to get an we recognize the need for breaks and for people for caregivers to have supports and time away from their loved ones, but there's a lot of information sharing and education that has to go on. So from a public health perspective, what does that look like to do that in a more broad communication strategy platform, and not kind of educating one person at a time, but using some of the tools that we've used in other public health strategies around media campaigns and communication strategies. So I think there's some interest around that and talking about taking breaks and what that looks like. I think we still continue to want to have a robust data collection system and really understand that. And I think there's continues to be work that needs to happen with those birthright questions. So whether we start asking some additional or separate questions on the panel survey, or what does that look like to get data that's meaningful, and how do we use our Healthy Aging Index to kind of point us in that direction. And then lastly, I would say we have some pretty lofty goals around what it looks like for work sites to support caregiver health, and what kind of policies are workplaces, both private and public, really looking to make that easier to happen as the population ages and the workforce ages.
This is Tracy, and I agree with all those, and for me personally, this is just me, that this is my and one of the things that I'm really trying to work to see happen is to really develop systems of care coordination for the caregivers. It's difficult systems to navigate, and trying to put all the pieces together when you become a caregiver, whether it's you've been planning on it for a while or it just happens suddenly. And there's lots of services and supports out there, but it's very confusing, and they're difficult to understand and navigate. And so my hope through our work with our leadership team and the public health and the Department of Health and our Human Services Department and our Children, Youth, and Families is to really work on that system to make it easier for caregivers to be able to find the place that will help them navigate those systems.
Great, excellent examples. Tracy, I might ask that you had mentioned I think you called it kinship task force, and that there would be eventually a report coming out. If you would keep us aware of when that report becomes public. I think that would be an important document also to share with our listeners.
Okay.
The other thing I want to go back to, and Chris has mentioned this a couple of different times, and just ask those on the call if they have any particular questions or comments around using the Breakfast data. That is one of the areas that ASTO, in partnership with the Alzheimer's Association and CDC, are really looking at closely, one in terms of the uptake, but certainly hearing today from Kirsten, there are some opportunities perhaps to further advance some of those questions. So any of our speakers, presenters that want to comment further on the use of Breakfast, or any of our listeners? And again, that would be *7 to unmute.
This is Kirsten, and I don't want to jump in too much, but this is a real big opportunity we see here in Oregon. And, older adults, and particularly those with cognitive health issues, are not going to be the greatest people to answer a Breakfast phone call. Mm-hmm. And I think we just have to get very realistic about where's the best place to get the meaningful data. So Breakfast is critical. It offers some really important population core components of the data, but it is, for this particular health issue, it cannot be the only source. It's not designed to do that, and the population we want to know more about may not be the ones who are going to give us the full story on Breakfast. And then that some of the questions I think are limiting when there's not common agreed language and understanding of what that language is in the field yet. Not in the field, among the general population.
Mm-hmm. Great comments. Thank you.
And this is Tracy, and one of the things that our department is doing as part of the, implementing the caregiver and the dementia plans is that we're working with our Alzheimer's Association has a medical science committee, and then we also have kind of an expanded committee made up of different researchers through our different research universities in New Mexico. And so we're just making sure that they're aware of what data is available and how to access it. And so that's another piece of those of using the data for the Breakfast.
Great point, Tracy, and a great point for the opportunity to step back and really assess where the data is. And I think you have both pointed out that the data can often sit in a department or office on aging, but there may be companion information that may sit on public health. So we know that that's an area for continued work. And also we're hearing more from our payers, be those our public payers like Medicaid or Medicare or our insurers. Where's the data there that we could use to actually help identify emerging trends and areas for action? So we're coming to the end of our time. Really a special thanks to our presenters for the time that they took to prepare some excellent slides. Again, I would encourage anyone on the phone to go back and review these slides. They're just packed with information. Again, want to thank our colleagues at CDC and at the Alzheimer's Association for their ongoing support so we can bring attention to this important need. And Lynn, I'll turn it to you with any final thoughts.
Yes, no, just ditto my colleagues. Thanks to all on the call and all who joined to present this afternoon. So Please just remember to complete the survey evaluation that'll pop up when you close the window today for the webinar. And if you have any questions, recommendations, anything like that outside of that evaluation survey, please feel free to email any one of us, and have a wonderful afternoon. Thank you all.
Thank you.
Thank you.
Thank you. Please stand by.